Let's see. Hey all.
Hi.
Hi.
We are running about 5 minutes behind, so we're most of the folks are still in the main plenary. So what I'm going to do is just make sure that I hop over there to make sure that people know where to go so they can get to this session, and we'll try and start maybe 11:45 or a few minutes after that.
Okay.
Okay.
Good to see you all.
Hi, Christina.
Hi, Brenda. How are you?
Good.
I think. Is John here yet? No, I don't think he's
No, he's not here yet.
okay. It's cold, isn't it? Like I had to put some thing here. I was like feeling cold. It's like.
Yeah, it is a little, it's a little nippy, but I prefer this kind of weather anyway.
I prefer a little bit warmer, but it's cozy. I can say.
Are you having a good day so far?
Yes, yeah.
Good.
We are busy at work, you know, being in Montgomery Parks at a lot of efforts because of COVID. So, but it's been good. You know,
Good.
so I'm planning after the symposium and some bites. I'll probably be going hiking. I said the work week was so busy. I want to make sure that I get some nature.
Indeed. I'm gonna hop off and send an email to John, because John is usually on time.
Yeah, I actually sent a text to him and say, hey, you know, are you waiting on the call? So it would be good if you send too.
Okay.
Hey everyone, they're just wrapping up now in the main room, so people should be migrating over.
There it is. Hi, John.
Hi, Brenda. How are you?
Good. How are you?
Hi,
Excellent.
John.
Hi, Cristina. Beautiful day today. Looking forward to actually getting outdoors.
I was just telling that to Brenda that as soon as we finish, I'll try to get some nature baiting.
Right.
Okay, sorry about that, folks. We've got something of a skeleton crew working today, and of course, you know, every IT problem that could pop up did. But thank you all very much for joining. As I said a few moments ago, people are transitioning, so maybe give them another 3 minutes to find their way here. This is one of two. There we go. I'm admitting more people. This is one of two concurrent sessions. Hi, everyone. Welcome, welcome. Panelists, I'm going to go ahead and make you a co-host. Let's see. Let's see, I'm trying to see where I'm not getting my participants window. Okay, here we go, admit. And I'm the host, come on. All right, well, I think people will trickle in. Let's go ahead, we have our panel. For some reason, I can't make the panelist co-host, but I can allow you to share your screens. I know, Christina, you have some slides that you'd like to share. So with that, I'll go ahead and open us up. So welcome everyone to the Green Space Equity in the DMV session. I had a whole document with introductions. If I could only find it. Sorry about this, folks.
We could introduce ourselves, if that'll make it easier.
You know, I think let's just go ahead with that. So
Yeah, that
for
works.
the room, and then of course there are people coming in, so I'm admitting them. Okay, so for the benefit of the room, thank you, welcome. My name is Jan Michael. I am a PhD student at the University of Maryland, working on environmental justice and health disparity issues in Dr. Jacoby Wilson's lab. We have a wonderful panel of people who are deeply engaged in green space equity issues here in the DMV. So I will pass the mic around. Let's start with John. Could you introduce yourself, your organization?
Yes, I'm John Henderson. I'm the executive director of ParkRx America. We're a nonprofit organization that works to connect people with nature for the physical, mental, and emotional health benefits. I'm also a city planner. I worked for 25 years in local parks and recreation. At ParkRx America, we work with healthcare providers to get them to prescribe visits to parks and natural areas for the treatment of a variety of chronic diseases such as anxiety, depression, obesity, hypertension, diabetes.
Excellent, thank you, John. Brenda?
Hi, everybody. My name is Brenda Richardson. I am an ecofeminist, and I have a company called Chozen Consulting, where I do community engagement here in the District of Columbia and a lot of environmental justice work. And I'm delighted to be here with you guys and these wonderful panelists.
Thank you, Brenda. Cristina?
We can't hear you, Christina.
Sorry.
Yep.
Okay, sorry for that. So I'm Christina Sasaki. I'm a park planner with Montgomery County Parks Department. I joined the Parks Department 4 years ago, but before that, my background is in architecture and urban design. So I work for international and national architecture companies, delivering projects for planning campus, neighborhoods, and transit facilities. And I'm really delighted to join the panel because, you know, I sort of transitioned to the parks field, and I'm excited to share and to learn everything with everybody who is interested in this topic.
Excellent, thank you. Vinice?
Good morning, everyone. I'm Dr. Vinice Jennings. I'm based actually in the Atlanta area, and I've been involved with green spaces and public health from a number of angles as a researcher, also helping to get communities, particularly kids and underserved communities outdoors and other facets of this field. I'm currently an assistant professor of public health at Agnes Scott College, and glad to be here and look forward to contributing to this panel.
Excellent. And last but not least, Isabelle.
Hello, good morning, everyone. Good afternoon for those of you who are not in the US like me. It's the end of the day already. So I'm Isabelle Anguelovski. I'm an urban planner by training. I'm also a geographer by love, in a way. I direct the Barcelona Lab for Urban Environmental Justice and Sustainability, which is a Spain-based lab that does research in Europe and North America around environmental justice communities, and looks at the drivers of injustice from the point of view of deep histories of urban development and inequalities. And one of the areas of work we do is around green space, equity, and green gentrification.
Thank you. Excellent. So we'll dive right in. I know we're a little bit behind schedule, so we'll dive right in with our second question of the session here. After the introductions. So considering the mounting evidence that green space contributes to health and well-being positively, it would seem that the role of green space is a transdisciplinary issue, one of many places where public health meets urban planning, or maybe not so urban planning. So how can these fields better collaborate, public health and public planning, to achieve green space equity? And so first I'll go over to you, Cristina. Oh, you're muted again.
Oops, I will be sharing my screen. Hold on a second. Can everybody see my screen?
Yes.
Good. So, well, I want to do first something that I forgot to do, because I didn't realize that this little introduction was actually the first question. Because we are talking about environmental justice, and people look at me, and so my question would be, if you just look at me, can you guess where I'm from? And I'm not gonna ask people to respond, but I'm from Brazil. I'm Brazilian, so but I'm also American. So I just want to say that sort of background experience brings sort of a different lens for me when it talks about equity. In Brazil, safety is a big issue for our parks. So I think that's something that I'm learning, is that we have the ability to create trust and community trusts in our parks and public spaces. And that's something that we don't do alone. With that said, I'm gonna just focus on the roles that we have in our parks, and pretty much, especially the urban parks, there is a big shift in the role. Parks are no longer just one amenity. When you talk about community facilities, it becomes sort of this platform for community experiences. And parks brings a list of direct and indirect benefits, but the one that relates the most with people is one's health. So I feel that something that we've been doing, and if you can see in the screen, we've been focusing on what we call the Energize Public Space Plan. And this plan is a policy document, and it's focused on being able to address the challenges of bringing people to be outdoors, because research say that 90% of outdoor amenities happen close to home. So we are trying to measure the access to experiences within a walking distance. So we start asking, for me, it was sort of really refreshing not to be I have 20 years of experience in urban design, but I didn't have the same experience in working for parks and public spaces. So when I was tasked to do the urban parks functional master plan that we called Energize Public Space Plan, I came from a place of a park user. So we start asking, where can I be active, and improve my physical health? Where can I, contemplate nature and relax and improve my mental health? And where can I go, meet my community, gather as a community? And that is becoming very important, especially with the pandemic these days, for my social health. So we are pretty much mapping active, contemplative, and social gathering experience from where you are. And that's the other big difference. Because of our technology, we are bringing this technology to really be user-friendly to the community. So we are measuring from where you are, where you live, anywhere. The focus is really you, the park user. If you live and work in the community, in terms of Montgomery County, these data-driven tool that we are putting together with the plan will guide you, where to go, what to do, but most importantly, we'll be able to map where we have our lower level of accessibility to experience, and then we're going to be able to focus on that. We are actually doing level of experience per person, so we want to make sure that we have an equitable distribution. Something else that I want to just leave, because I know other tenants will be speaking, is that Montgomery Parks is really doing a great job in terms of addressing COVID. So if you go to montgomeryparks.org/COVID-19, you can actually find all the efforts that we are doing in order to serve the community, to be able to open our outdoor spaces, even our some other parkways that we close, and but doing it in a safe way.
Thank you, Christina, and thank you for sharing this framework. I think we're going to get back to it when we start talking about how mapping and other kind of internet tools help us engage with parks and quantify and qualify our park space and the equity issues around them. John, how about you? How, from your experience working with ParkRx, how can the public health or the medical fields work better or more synergistically with public planning?
Let me start by saying that the environmental sustainability benefits of green space have been promoted now for several decades. To reduce the heat island effect and to reduce stormwater runoff and clean the air, and the science behind that has pretty well been accepted. But when you're in the realm of public health and nature, the research is still ongoing. And even doctors don't hear about it in medical school, and that provides a resistance to them even considering writing a prescription for people to be outdoors. The concept of ParkRx originated in the fields of recreation and public lands management, and those people speak a great different language than anyone working in medicine or public health. And so that creates a tremendous barrier of communication. So when we're working, we have to find people that are champions and have really good credentials and are accepted in both worlds, both that public lands management and in medicine and public health. And that's not easy. And then when you get into the research area, as I said, the research is still ongoing. You have researchers in the fields of biology, anthropology, forestry, psychology, and as you can well imagine, it's difficult getting all of those people to coordinate. But I must say that if you look at the current research, a lot of that research is cross-disciplinary, and so these people are actually finding each other and putting together some amazing research. And I see convergence on a couple areas. I think in the future, the therapeutic benefits of spending time outdoors will become widely accepted. And second, I see that the green spaces in our cities, those schoolyards, the parks, the gardens, the trails, those will in the future be considered as essential green infrastructure that is managed as a totality to sustain not only the environmental sustainability benefits, but the human health benefits.
Thank you. Brenda, as a community activist and community leader, how do you weigh in on this in terms of what you're seeing as the gaps, and what's lost with this failure to connect public health with public planning? Hope you're muted.
Thank you, Jan Michael. I think there are a couple of things. I think, first of all, when you have planning and public health at the table, is the community at the table. And when I talk about community, I'm talking about disfavored communities and this notion that folks of color are now exhausted in light of what's happening with the protests and COVID-19, which I now call COVID-50, because we're finding that in light of this new sedentary lifestyle, that folks have gained a considerable amount of weight in urban communities. So what does that mean? It exacerbates our chronic disease in our communities, obesity, diabetes, hypertension, and so on. And I think that it's so fascinating to me. I'm with the Friends of Oxen Run Park here in the district, and it's the largest park in DC's, the DC government's inventory. And it's just so fascinating to me how folks of color will use parks for basketball, horseshoe pits, and barbecues, but the trails are often empty. And one of the reasons that I feel so strongly about what John is doing is that we've got to figure out a way to get more of us on the trails, because I'm a strong believer that if more of us started walking and understood the value of how that has an impact, not only on our physical health, but our mental health. I've become a new champion of behavioral health, because we're also finding that during this period, a lot of folks are just feeling much despair, more so now than they ever have. So I think nature, forest bathing, walking is medicine, and it's free. And it's in our backyards. So I would love the opportunity to have the folks in the disfavored communities sitting at the table to help figure out how to connect the dots. Thank you, Jan Michael.
Thank you, Brenda. Vinice, your response.
I think that's a great question. And actually one of the things that really motivates me in my line of work is really to help connect the dots and to bridge those conversations. You know, even from my background in terms of having that interest in the environmental field, but then, you know, growing up and attending high school in a county that was having environmental justice issues, I've always been motivated to help connect the dots and to bridge those conversations a lot more cohesively. And even in my line of work, I can put it in the chat, just some different articles that I've written in the sense of really helping to frame these conversations. And that's in the sense of really framing in the sense of what are social determinants of health, being those conditions where we live, where we work, where we play, where we recreate, and how that overlaps differences in public health, being health disparities and health inequalities. So when we think about those you know, the different terms, and even from the environmental side, ecosystem services being the benefits that humans receive from the natural environment when it comes to public health and well-being, when we realize that we're all different fields who have a piece to a larger puzzle, I think that's one of the ways that we continue to break down the silos, but also have a cohesive conversation, or at least a conversation where we're understanding each other, not only in the scientific literature, but in the larger issues of society at large.
Thank you. Isabelle.
I will talk a little bit more from a research standpoint, let's say from a researcher standpoint, and from what I see colleagues, you know, I feel I'm in between public health and planning, more probably from the planning standpoint, but from a lot of the conversations I have with my public health colleagues, data, we don't speak the same way about data, you know, in their way, they always calculate proximity, spatial proximity to green space, depending on where you live, the location of green space, and then race and ethnicity or even income oftentimes become a control variable. There is also, so in that sense, I think that the deep understanding of really what access means is something that I haven't seen many of my public health colleagues, at least here in Europe, study at length. And then from the point of view also of green space, you know, there is the NDVI variable that still is very much the dominant variable that people use to study green space, when actually there's so much more in terms of what makes an amenity, as the other panelists were saying, welcoming, secure, etc. I also think that within the public health field, again, I think that in the US, folks are, or let's say more cross-disciplinary in the way they think, and probably less so still in Europe, is that I think all of the obstacles that exist in people's lives and experiences and perceptions about related to going to a green space is really something crucial that public health needs to take into consideration. Histories of segregation, gentrification, senses of exclusion, violence and control, as we know so much from the Black Lives Matter movements and what the claims are about. I think the time component are also key, that, you know, you might have access to a green space today, but with gentrification, you might not have it 5 years down the line, or even after a park that was announced actually ends up being built. So I think that's kind of maybe the missing lenses from some of the public health research I see, and that planning can help contribute. And then on the other hand, I think that what planning really needs also from public health is kind of an understanding of environmental risks and more environmental risk shifts. So, you know, we've talked so much as scholars and activists about environmental justice communities in relationship to air and pollution. And now it's also much more about inequities to green space. But oftentimes those issues are very connected and remain together, because greening has become so apolitical and has become so much of an embellishment and an aesthetics that's part of the green city planning, that in the end you have green spaces like in San Francisco, in Hunters Point, built on top of contaminated areas, or with the Gowanus Canal in New York. So I think that the compounded risks that environmental justice communities are facing is still something that really planners do not necessarily see necessarily, and that public health can help a lot. And then finally, I would say what public health can also really help understand is how you cannot create green space without other mitigation policies that will improve air quality, remove cars from cities, and create an urban environment where green space is not just going to be a new space that you can be, but it's surrounded by an environment that you are impacted by. And so you need to pacify streets, you need to have measures related to transit that accompany green space to make it a place of justice and access for everyone.
That was an excellent, excellent answer. And it just shot off so many light bulbs in my head. I'm going to take us a little bit off book now to kind of dig deeper into, because Brenda kind of mentioned it, you know, with people of color or people like us not being on the trails, being at the courts, being at the picnic areas, but not being on the trails. And I want to dig into why that is and talk about barriers to access. And I want to also, if the panelists could speak on how you've encountered these barriers in your immediate projects that you're working on, but not barriers in not just creating equitable spaces or creating a space for equity in the conversation, but also the physical barriers and the community barriers that your constituents and the people that you work with and interact with. What do they see as the barriers to engaging in nature? So I'll go first with Brenda.
So I'm so glad you asked that question, because I think one of the things that I find in my own neighborhood is one of the barriers is trees. When you go on the trails and because I started a walking club, and we ended up having the police join us on the walking club because there's this fear that somebody is going to jump from behind the tree and hurt you. There's a fear that drug dealers are hiding their drugs behind the trees. And that is indeed a barrier. And I think the other thing is that it also offers us an opportunity to be more social and practice social distancing with our masks, because it was really, really easy to do. But I think that the other barrier is having our community understand the benefits of green space. That's why I was so delighted that John was doing this RX program, because if my doctor says that I get a prescription and he says I got to go to the park, then I got to go to the park. But Jan, I just wanted to also add that whatever it is that we discuss here, it's so important to be mindful that we always talk about things are put in place, but nobody goes back to evaluate it to see whether or not it's working. And if it's not working, do you have the flexibility to do something so that it's tailored toward the culture of the neighborhood? Because all people of color and their neighborhoods are not the same. And that's why I said it's important for us to be at the table, because what happens in my neighborhood may not happen in Vinice's neighborhood. So you have to hear our voice And because our voice is not being heard, I think that's a barrier as well.
Absolutely. Does anyone else want to? I won't dictate the order. Who wants to go next on barriers?
Well, maybe continuing a little bit on that thread, I think that there's so much disconnection between environmental planners and planners from housing and community development, as there is also in a way from traditional environmental NGOs, even though groups like the Trust for Public Land and even the Nature Conservancy are trying to consider equity more in the way in which they push for urban green space. But I mean, exclusion is, of course, all of the histories of crime and lynching and violence that is reminiscent of many people's memories of green space, deep exclusion of people of color in nature that goes back to the way in which national parks were created in the US. But for instance, what we see now in a lot of our work on gentrification and green gentrification in particular, it's this overtaking of space, of green spaces that are either renovated or provided as part of a new real estate development or even as part of climate adaptation. I see that in East Boston, where I spend a lot of my life, where the waterfront now has these beautiful parks and what they call biodiverse shoreline and all of that. But the waterfront is completely plastered by luxury condos. And so you have the young kids that used to play basketball there, that used to go to the park, that are like, we get looked at for what we do and how we behave in space. So it's that sense of exclusion that comes from the social cultural behavior of the newcomers versus the longer time, or not necessarily longer time, but residents who were there before, that creates exclusion and that makes equitable green space difficult. And then, of course, there's a whole history now of eviction and of real estate development speculation that creates an ability for many people of color and white working class as well to remain in a neighborhood that's now green, again, especially because there is the green branding, the green city that has become a planning orthodoxy that now justifies so much of real estate development, and it makes it very profitable, but then at the expenses of residents and their use of green space, when the end gets displaced to browner communities, because where pollution is where they can often afford to live. So that's the type of conversation we have sometimes difficulties engaging people around. That it's also a housing issue, it's a recreational issue, it's an attitude issue, it's kind of social, cultural, and physical displacement together.
Thank you. Cristina, Vinice, John?
I can go. Well, something that I heard Brenda saying about, not the use of trails. And, I grew up and I studied and I went to college in a third world country. And when you go to a trail where you have nature, but you don't have necessarily people there, it's pretty scary. The first thing, like I mentioned before, is safety. So these spaces, for certain cultures, to have a green space and an empty space is the best scenario you can find. Like, I marry a tree hugger, so my husband loves when it's just nature and him. And for me, in the beginning, it was a trust relationship that I had to build. He would go to these trails where there was nobody, and he was like, "Oh, what a beautiful nature!" And I'm like, "Is that safe? Is that secure to be here?" It's like, so that sort of culture barrier, because where you're coming from, what are sort of your previous experiences, in being in nature, you have to overcome. So that's what I mentioned, that, community trust, you not only have to offer the spaces and the amenities, it's almost like we say, if we build things, will they come? Not necessarily, because you have to have a sort of a connection with different partners in order to promote. So I think one time I was talking to John about, the Parks Department, we are the providers of service, but we really have to rely on other organizations, community friends of, different parks and other community organizations, other agencies, to really promote people to come together. And one thing that recently I was talking to park police and some of the park managers, we have, in certain areas of the county, we have a lot of litter problems, homeless problems, drug use in our parks. So nothing is isolated. It's like you have to see the access to nature especially in the urban areas, very challenged because sometimes, you know, you overcome the culture barrier. Maybe people feel more comfortable. Like Brenda, you mentioned that, you know, you have a group of people who actually walk on the trail, you know, so you are not there alone. So you kind of start creating that bond. But then, you know, if people arrive there and then you have, you know, litter everywhere, you have like a situation where you don't feel safe, then you kind of backtrack, you know. So it's sort of, you have to work with different agencies to sort of achieve a common goal. It's never one's agency problem or is the community problem. So I think that something I'm learning, you know, like with our work, with specifically my project work, we are trying to map as much as we can in terms of things. We create design guidelines with community members and designers in order to look at the quality as well. And then we went with like community survey, and we're actually going to start a new community survey in order to understand, you know, what are the things that the mapping system doesn't catch, because a lot of things don't catch. So even though we are mapping certain factors, we cannot just rely on those factors. There are many other factors. So I remember when we were doing some outreach, we had to go to groceries, we had to go to places of worship, we had to go to recreation centers, you know, to really reach out where people are to get their input. And the most interesting thing that I got from all these sort of different surveys that we've done is the minorities and the immigrant communities, the thing that they wanted the most were places that they could gather as a community. They felt, you know, like, I remember like a funny observation that one of the responder was saying, well, you know, Americans, you know, their family is like 3 or 4 people, you know, but our family is like 10 people, you know, so the picnic tables don't fit everybody, you know, so it's sort of funny. And like the most sort of used amenities are like the barbecue kind of little things that they have in the park. So it's that sense of creating community. So I think that if we can attract people to go to these places and create this, it's like, if you don't care about your park, you're not gonna preserve it, you're not gonna enjoy it, and you're not gonna go there in a daily basis. That is really important. So I think that trust and that sort of embracing the sense of community is really important.
So I'll jump in. You know, green space is both a supply and a demand issue. And if you're trying to increase the supply of green space in cities, it's really, really hard from both a time and an expense standpoint. And so unless you're dealing with an area that has had a lot of disinvestment and there are a lot of vacant land, and even in those situations, you know, with environmental remediation and removal of debris and whatever, yeah, it can literally take years in order to prepare a site, you know, for redevelopment. So in many cases, the most efficient way to you know, create more green space is to actually try and connect all of the existing spaces that you have in your community, whether it's, you know, schoolyards, vacant lots, stormwater infrastructure, gardens, and trying to make something meaningful out of that. I helped to found an organization in Chicago called ArchiTreasures, and we worked with local community people. This is mainly in Latino neighborhoods, and we tried to work with artists, landscape architects, urban planners who really enjoyed working with the community residents to help them achieve the vision for their community. And to Christina's standpoint, you know, what they wanted were these community gathering spots, the casitas, and, you know, where people could come together. On the demand side, which is where we are, we're trying to provide those nudges, the incentives to get people outdoors. As Brenda mentioned, you know, we're trying through these prescription programs, you know, to you know, if you trust your doctor, your healthcare provider, and he or she is telling you to go outdoors, you're more likely to do it. And we're so disconnected from our natural environment. You just need that incentive. Even if you have wonderful opportunities, like, you know, Cristina has in Montgomery County, Maryland, they're not going to use it unless they get that additional incentive. And to some of what Isabelle was talking about, this issue of gentrification is very real, and it's gotten so bad that neighborhoods really reject any proposals for investment because they're afraid that the real mission is to displace people and to get rid of them, you know, to improve the neighborhood for new residents. And another word of caution, with our equity measurements or whatever, we have to be very careful that we're not inadvertently adding to an already negative characterization of some of these neighborhoods. There's some of them are already bombarded with all kinds of negative messages, and if you continue to add to that negative reputation, it weaves its way into policy making, and as you know, government leaders come and go with the political cycles, and quite often promises are made and things don't happen, and so we can inadvertently make things worse than they already are.
Sorry, I was muted. Thanks, John. Vinice, I don't know if you wanted to jump in before I transition us away.
No, a number of great points have already been mentioned. You know, there's so many facets to the question in terms of access and even the experience. Everyone's access to green spaces are not the same. And even once someone goes to that particular green space, they want to have different types of experiences. But there are so many layers to it when it comes to the structural or the, you know, as Isabelle mentioned, the planning perspective, whether it's sidewalks, safety, even the traffic signals, different things around that space that help it to be there, the presence of crime and other social factors that lead to people to either go to these spaces or to not go to these spaces. And also, you know, just keeping in mind that no matter if the person decides to go to barbecue or to go watch birds, these spaces have to be places where people can go, belong, and recreate safely. So with that being said, you know, the experiences evolve, but it's one that's very personal, and it's a reflection of other things that we have to continue to resolve in our society.
Jan, may I add something? Vinice,
Totally.
I'm glad you said that, because the Friends of Oxen Run is working very closely with the Department of Parks and Recreation. And DPR is building an outdoor fitness center. So hopefully that will be a destination to attract our community to come and work out. We're also partnering with the Audubon Society so we can start teaching kids and adults how to be bird watchers. That will give us another reason to come into the park. So I think the other thing is that sometimes we have to think outside of the box about how to engage folks in light of the barriers that we're constantly exposed to and that constantly exhaust us.
Absolutely. Thank you. And so we've hit on a little bit here and there about measures and indicators. So now I'll go back to the question about mapping tools and kind of these index tools or indices for measuring not just green space, and NDVI is one of the major indicators of just measuring tree canopy and land use there. And for people in the chat, I use the acronym so much I don't remember exactly what NDVI stands for, but it's a measure of it's using satellite imagery to kind of measure the reflectance or the refractance from the leaves of trees. And so you can use that to kind of get a measure of how much green space there is in an area. So moving on to the use of EJ screening tools or any other kind of mapping or satellite imagery to help inform policies, whether it's at the county level or above, or more local or towards the federal end. These tools and others, what do you use when you're trying to explain or get a better picture of what you're looking at in a specific area for these green space issues? What do you use as the measures? What do you use as the indicators? Which indicators do you avoid? I'll go to, let's see, I had this planned out. I'll go to Isabelle first.
Thanks. That's a very technical question. I'm afraid of answering wrongly according to your expectations. But I mean, as I was saying a little bit earlier, I think there are different moments in time where we need to consider, let's say, the impact of green space, because you have like tools such as the Greenworks Equity Index that the city of Philadelphia has, or Los Angeles has a similar tool, or Denver is working with a similar one, where you're trying to assess spatially where the greatest number of green amenities are needed to address different climate adaptation challenges, for instance, like heat island effects, or stormwater management, for instance, or air pollution, filtration, etc., and where also there is a highest number of census tracts that are deprived with playgrounds or other types, let's say, of recreational like amenities. Okay, that's one piece, and I think then measuring progress towards lowering the gap is between, let's say, better provided neighborhoods and those that are more deprived is an essential and pretty easy tool to figure out. I think what's important to also follow, as I was trying to hint at before, is the question of green gentrification. Like, what is happening over time to neighborhoods that have gained green space, and then residents have shifted in terms of their composition. And so we've worked with different green gentrification index, where we look both at how an area has changed demographically, looking at income, indicators of income, education, race, and ethnicity, together with another index, which is the one with real estate prices. And so we kind of bring that all together to basically study how a census tract around the green space, and then the other ones around the green space have changed in comparison with a district as a whole, for instance. And so you use different types of spatial models to understand the impact of green space. And then there's a last one that we are trying to work with now, which is the question of vulnerability to gentrification. So knowing what neighborhoods have gone through in terms of social change or demographic change, and also the green spaces that have come in the neighborhood, what are the risks of other neighborhoods that are adjacent or even in other parts of the city to also gentrify as they become greener? So in that sense, it's a vulnerability to gentrification index in the context of green space, and it tries to assess then what are the neighborhoods that are going to be needing most support in terms of affordable housing, in terms of rent control, in terms of community land trust, all of the types of anti-displacement housing measures that will make greening there not a displacement tool. So I would say that's kind of the third temporal tool we work with.
It again. Cristina, how about you for Montgomery County? What kind of indicators and measures, and I know you talked a little bit about this with the EPS metric.
Yeah, I'm going to be sharing the screen because it's easier to show than to and speak on it. Can everybody see my screen now?
Yes.
So I'm going to be showing two slides. One slide is what Isabelle was talking about. A lot of our agents, I know, like the Trust for Public Land, City Parks Alliance, ULI, they were all using the 10-minute walk to a park campaign. And I was very excited. I'm like, I'm going to use that tool. And I did. And we were using for Silver Spring was our pilot area. But according to that tool, because it was measuring walk access to parkland, Silver Spring was perfect. And I'm like, well, wait a minute. Yes, we don't have walkability to a park, but not all parks are created equally, So you are saying that if I have, a little piece of small park, I'm served the same as somebody who has like this huge trail, these beautiful trees, and I just have sort of this hardscape with maybe a playground, So I start thinking about how can we actually start mapping things that would actually make a difference for the community, because a lot of the times we have measurements that are good for the planners, to justify grants, to justify policies, but what about mapping something that is actually meaningful to the community? That's when we start thinking about measuring access to something to do, to this specific amenity. So we have a list of 90 plus amenities that we measure access to. And believe me, we went to not just our parks. We said, let's take the sort of the agency hat. Let's look at everybody else's resources. As long as it's public accessible, let's measure. So we measured access to all public spaces, independent of ownership, state, federal, private-owned public spaces. As long as it was accessible, we measure. So what you're seeing here in the map is pretty much the map on the left side of the screen is the consolidated combined levels of experiences of all the three experiences together. So where you have the green color is where you have walkable access to a higher level of experience versus the red one is the lower. And then you have for active, contemplative, and social gathering experiences. So the lighter color is where you have the least access. But that doesn't take in consideration equity. That's just pure distribution of where we have the resource. It helps us to understand where we have the lowest, but then what we decided to do also, we decided to transform these more detailed information in census tracts so we could compare with race and income. So we look at the census tract with race and income. So we combine what are the areas with the lowest level service and what are the areas, where we have the highest concentrations of non-white, lower income residents. And that allows us to start prioritizing some areas. It doesn't mean that we're not going to give attention to the other areas, but we're going to start identifying what makes these areas priority. Sometimes in a census tract, a park can show up as perfect, but you have to really dig and dive deep because some parks are not poor in amenities. You can actually walk to all these amenities, but there are a lot of crime happening there, so people do not use their parks. And so the tool cannot, identify that. So the tool is just helps us to give sort of a similar baseline, apples to apples comparison throughout, all these different areas in the urban areas that we are trying to compare. And then we are trying to see, what are the majority of the people who are more vulnerable, the underserved communities are. So it's just like a starting point for that conversation. But we also, what we are doing in our plan, we are identifying 5 strategies because the solution is not all the time buying land. We are looking at connections. Sometimes our strategy is to connect. Other times strategies activate, because people are not aware of the park there or don't feel, they don't know if what they can, sometimes they don't know even how to play. We have 1/3 of our county is foreign born. So a lot of the times there are the sort of, new world environment that you have to kind of, can I actually play in that field? I'm not allowed to do that even if it's a public space. And then we also have strategies of repurposing, sometimes the community doesn't want that anymore. It's not useful. Demographics change. And then also the last one will be create, but we are looking at different strategies to target this sort of lack of walkable access to these recreation opportunities and, trying to see with different lens. The planning department is currently working on the update of the general plan. So in the future, we will have an equity layer as a final layer. The county is also starting a community health needs assessment. I just joined this year the Healthy Montgomery steering committee. So I'm hoping to also collect some health data. So it could also be overlapped. So we can start looking at, what are the areas that have all these sort of top issues, and then sometimes, like Isabelle said, sometimes we don't want to discriminate the areas that actually go to the top because they have all these issues. It's the ability to say what is causing that, because sometimes just because you have the data, you don't know how the data was created. It could be just lack of physical accessibility, so these are the things that we start discussing and looking, and and we are hoping to be able to collect more information as we publish. Like we just started the Silver Spring sector plan. Equity is a big thing on this new plan. It's going to be the first time I'm going to be using the EPS 2 as well in the plan in terms of parks and public spaces. So we're going to have a great opportunity to interact with the community and learn what are the issues, because Silver Spring, it is an area of equity that we are trying to focus.
Excellent, thanks. I'll go over to Vinice, your experiences with these tools.
Right. Well, I think that one of the things to keep in mind is that the tool can vary, you know, to Isabelle as well as other points. So the tool can vary depending on the issue you're trying to investigate or address, as well as the context of the particular public health outcome that you may be looking at as well. So in my studies or other programs I've been involved in, that could vary. For example, a project that I was it stemmed from my dissertation in the sense of a research in Tampa, Florida. That particular city did a tree inventory periodically, but some of the actual ground data that I used in that study was from the iTree Eco tool. It's based from the U.S. Forest Service, but it has other inventories throughout, you know, other cities in the U.S. and other cities actually do tree inventories. However, if you're looking for something maybe a little bit more park oriented, some people may go about maybe a park score type of information, but again, it depends on what it is you're looking for and then the actual benefit that you want to consider in that particular question.
Absolutely. Thank you. Thank you. John, when you are interacting with medical doctors and setting them up with the Park RX framework, are there any other kind of metrics other than, you know, I see a patient that has these parks in their area, so I describe them to go out to one of these parks. Is there any other kind of layer of analysis to make sure that the doctor is sending them to a higher quality park compared to another park?
Well, that's a great question, and it's something that we're working on. You know, if you look at our site, parkrxamerica.org, basically what comes up as a park finder. So we are using the generally available information that park agencies provide, you know, to the patrons in their communities, and so it's not really medically relevant, to use a phrase, but I think in the future there's wonderful research going on about dosage, about linking the health properties of various types of landscapes, you know, about soundscape and tree cover and various characteristics, and you can link that to the treatment of a specific disease. We're not there yet, and it's going to take several years. Based upon the other comments, I wanted to say that most of the green spaces in American communities are provided by the Parks and Recreation agencies, and Park and Recreation in most cases is like the lowest level of the government. And so they're usually very strapped for resources, have limited capacity. And in some cases where there's a income divide, there are wealthy parts of the community and very poor parts of the community, the Parks and Recreation can be viewed as only for the poor people, because the rich people have all these other opportunities available to them. And so there's little support for raising taxes to support, you know, parks and recreation. It's a big issue. And when it comes to measurement, usually, you know, because community planners historically viewed as parks as community facilities, just very functional. You know, the measures are typically like level of service standards, like the number of acres per 1,000 people, or the amount of, you know, inspections occurring per month or whatever, very crude measures. And then they overlay census information about race and income and ethnicity to try and determine if there's any historical levels of discrimination. But that doesn't even begin to get to whether these places are welcoming for people to go to get any kind of health benefit from nature. You have to look at, you know, how these places are perceived. You know, are they comfortable? Is there, you know, drinking water? Is there shade? Are there toilet facilities? Is it accessible for people with disabilities? You have to look at the perceptual, you know, what is this history of this place? What are the characteristics of the people who are currently using it? You know, is there any historic issues with safety, environmental degradation, maintenance? So all of that stuff, it's very complex, but you have to get down to a very fine-grained level, and most park agencies don't have the capacity to collect that kind of information.
Yeah, thanks. And that actually leads me to, I saw it in the chat, I think it might have been Chris Keels made a note about this issue of competition, not just in this resource allocation and resource management, but competition between green groups, funders, city sources. Let me read the comment. So Chris Keel says, I think one of the other barriers is organizations competing against each other with city sources and funders instead of collaborating. Are networks developing and sustaining themselves without letting others in? Community investment sabotage. I think we also have to be careful with defining all people of color access or feeling about being outside in the same manner. So we've touched on that last point in terms of you can't paint communities, even two Black communities in the same area, you can't paint them as the same community. But I'm wondering if the panelists have anything to say about these other kind of many mouths, trying to get at these resources and speak to that kind of as a barrier.
Well, Jan, I just wanted to share that community measures too. So I just wanted to emphasize that the DC Department of Transportation's Urban Forestry Division is doing a magnificent job of improving the tree canopy here in the District of Columbia. The fascinating thing is that the tree canopy needs the most improvement east of the river, where a lot of people of color who are experiencing terrible health disparities live. And I guess when I was thinking about the indicator for me was disfavor. The tool is showering people of color with favor before we get booted out of our communities. And the measurement is show me the money. And I say that because, we talk about green space and there seems to be this goodwill to do more about green space and funnel dollars into that. But when you look on the public health side, I'm reminded that women in my community east of the river has the highest incidence of breast cancer than any place else in the region, let alone in the District of Columbia. Where's the money to do something about that? So I have to tell you, sometimes when it comes to research and data, I'm a little jaded because we find out what the problem is, we find out how big it is for people of color, but who's providing the funding to make sure that that risk is reduced? And I hope that in the course of this conversation, that as you guys think about what it is that you do in your various jobs, that you're just mindful. It's great to have research and data, but if our health is not improving, we'll be here 10 years from now having the same conversation. And I think that needs to change.
Absolutely, and I very much appreciate you making that point, because one of the things that our lab in particular, the Community Engagement, Environmental Justice and Health Laboratory focuses on is getting away from that colonial science and that extractive science where you're collecting data for the sake of collecting data or for the sake of getting your graduate students out the door or getting publications out. If there's no change to the community's assets or there's no improvement to the community situation, then your research is definitely not community-based. It could be based in a community geographically, but you're not based on the community in any way. So thank you very much for bringing that up, Brenda. I think so. We're at 12:45. This session ends at 1:05, and we want to do a Q&A with the audience. So I just want to ask for lessons learned. I want to speak about the positives. And so what are some of the biggest lessons that each of you have taken away from the work that you're doing? What should the average person know about the distribution of green space and green space equity issues, and any solutions to addressing these inequities? So I'm going to start with Vinice. Oh, and while you're in the middle of writing down.
I was writing down the different tiers to your question. So you said the issue or lessons learned and then solutions.
Sure. Yep.
Okay. Well, there are different aspects in terms of lessons learned. When it comes to just my journey through this field, I've been reminded not only you know, my academic lens, but my lived experience continues to inform the work that I do. And that's one of the reasons I'm really passionate about, you know, these types of conversations, because they help to renew our perspective of not only the work that we do, but the communities that we live in, but ultimately the health that we all should have access to. So when we think about, you know, that definition from the World Health Organization in the 40s, that health is just not a clinical diagnosis, but this larger issue and this larger community of health, to really make sure people connect those dots, because sometimes we may not necessarily think about that. But I think if, at least during these times of COVID-19, we're just being reminded that having these outdoor outlets, but the way that we interact with one another matters. And to continue to reinforce that in my area of work. Also, when it comes to not only my role as in terms of education, whether that's in higher ed, and also different things that I do with youth in the community, just remembering that we have a responsibility to continue to provide these educational opportunities, but also to provide, not only pass the baton in the sense, but remembering that we have a responsibility not only in our communities, but also in our workplaces. We want to diversify these fields. We want to provide youth and others with these different tools. Providing spaces for them to fully flourish is critical. You know, it's like planting that seed, but making sure the seed has the environment to truly be able to grow. And I'm looking forward to continuing to not only add to that conversation, but the solutions to actually bring that about. And I think the policy lens is one that continues to be important.
Thanks, Vinice. Isabelle, are you still there? She might have gone away.
I am still there. I am still there. I mean, from what we see in our work in Europe and also in the east of the US, we really see still a disconnect between green space and other community development work that's carried at a city level. And I think that is still kind of a challenge of multi-sectoral work that needs to be brought much closer together with green space planners thinking with the community, with a variety of residents about what accessible green space is about and what it will mean in the future if you create a park of a certain size, of a certain design for the appeal of a neighborhood for newcomers, for instance. There's also a tool that we found has worked quite nicely, and it's been used in a lot of European cities like Nantes in France, Amsterdam, Vienna, which is more about equality of green space. So in that sense, every neighborhood has to have a park of a certain size within 300 meters of everyone's residence. So in that sense, it kind of provides a buffer against the flagship or the emblematic effect that some green spaces have in cities that again then bring with them a lot of real estate speculation and other types of injustices. So we found that the equality is actually also nice to have accompanied with, let's say, to be at the same time equity and equality together. And a combination of more informal, formal green spaces of different sizes, of different types, so that then there's a sense of, let's say, possible belonging and possible uses and appropriations that's different by different people. And then finally, maybe to conclude, the whole aspect of housing. Like, you cannot disconnect green space activism, I would say, from an environmental NGO, from an environmental nonprofit, from a demand for affordable housing, the protection of public housing stocks, the increase of public housing stocks, rent control, different housing policies that cannot be decoupled from green space equity. And so I think, of course, in the US, the question of the federal level involvement is key. And I know now politically is not a good moment to have the federal state back in, but it's absolutely essential to guarantee that new green space additions are not going to displace people over time.
Thank you, thank you. I'm gonna go to John, and then Cristina, and then Brenda, and these are gonna have to be a little bit quicker so that we can get in some Q&A.
Thanks, Jan. first I'd say, through my experience, it's extremely difficult to reestablish connections to nature that we as Americans, for the last 50 years, have been incredibly distanced from nature. You know, I think ever since air conditioning was introduced in the 1960s. But, you know, before that, you know, the house was a permeable membrane. You know, the doors and the windows were open. You know, you went to sleep at night hearing the insects and hearing the leaves rustle. You know, we're continually cocooned in our homes and our offices and our automobiles. And so it's really hard to get people outdoors. Second, in a more positive, is that you can have a really meaningful experience with nature in a very small spot. You can even have a meaningful relationship with the tree growing outside your window. So it can be done, and I think what we're doing with ParkRx is working on that demand side, getting people to want to be outdoors and to connect with nature, and the way we're doing it, these what we call the prescription is individualized, you know, to each person. So regardless of your age, your race, your ethnicity, your gender, you know, the healthcare provider works with you to find a way to get you outdoors in a place that you will feel safe and where you can have a really meaningful experience.
Thanks. Christina.
I'll be brief because, you know, I'm trying to promote this project because I really want people to get outdoors. So something that I really learned through the process is that you have to give the first step. Our tool is not perfect, but it is already better than just accessing parkland. So we are putting more. So I want to keep putting more things in the tool. And, you know, like I mentioned the help in Montgomery. So that's something that I want to work together. That's why I joined the steering committee. So we are all students all the time. So I think that it doesn't matter how much experience or how much little experience you have, as long as you're always open to listen to what the community, what your colleagues, what other people have to say from their personal experience, from their background, is what's going to make your project special. You know, it's like there is no magic formula. I think that technology is helping us a lot to empower communities that do not have a voice. I feel like the ability to document all these things, to represent, even if in a not perfect way, but to be able to represent all these inequalities that are happening with the spatial distribution of our communities. So I think that the lessons that I take from now is that it is always good to participate in such an environment because you meet people with so many different backgrounds. So thank you for the opportunity. I hope that I can leave in the chat my information, links to the project, and I would definitely encourage to continue that conversation. You know, I learned so much about Brenda because we had a chance to meet a little bit before, and I just want to continue learning. And I want to learn from Isabelle. I know she's from Barcelona. You know, like I speak my Spanish is like that because of my Portuguese, but it's something that I want to learn. And I want to say, you know, like don't look at somebody and assume things, you know, because in the community meetings, people look at me and the Chinese ladies come and try to talk to me and I'm like, oh, I'm sorry. But then people come trying to speak Spanish and English and I say, oh, I can actually understand, and they get surprised. So go beyond, you know, what you see in front of you and try to talk to people to actually see, you know, behind this mask that is just, you know, visual, what is deep inside. So thank you for that opportunity.
Thank you, Christina. I think the lesson that I've learned is that we have an opportunity to reignite our spirits and to reimagine our new future, and we have an opportunity to do it together. And I think that as it relates to a solution, we should make greater investment in health and nature and put a moratorium on gentrification. Thank you.
Absolutely. Thank you all. So at this point, I want to open it up to members of the audience. So we can do this one of two ways. You can post questions in the chat, or you can raise your hand and I'll call on you to kind of deliver your question in your own voice. So I'm going to scroll through the chat to see what questions we might have already been placed. So Larry Davis asks, From a research perspective, is there a disproportion of green spaces that underperform or fail in the district, specifically talking about DC? So, and I think maybe talking about a disproportion in terms of, are there certain communities where green spaces are more likely to underperform and fail versus other communities, and what might be the dynamics going on there? I'm not exactly sure what you mean by fail, Larry, though, so feel free to chime in.
Yeah, could he explain what he means by fail?
I can just jump in. You know, the Trust for Public Land has rated DC as one of the best places for green space in the entire country. Mm-hmm. But if you look at the qualitative aspects of these green spaces, quite often they're really not desirable from you know, for example, you know, the vast majority of the green space in the district is provided by the National Park Service. And a lot of these are like historic places that can never be developed. You know, they say they're historic. And so you have all these like little forest places, you know, where there were forts and have all this history, but they can't really be used for any purpose. So they're there, and I guess they provide some environmental sustainability benefit, but they're really not useful for people.
I do think that Larry has left the room, so we might not get any further on that. But another question that's come to me, Cindy asks, do any of the panelists have any book recommendations on green space equity? Or articles or videos?
Right. Well, I left a few articles in the chat when it comes to, you know, looking at social dimensions of equity and access to green spaces. I've written a book on urban green spaces and, you know, that the way that looks across the United States. It was published last year by Springer. And also in terms of lay literature, I've written something in the sense of, you know, why we should fill that green space gap. I can put that in the chat for reference, but the book could also depend on what, you know, if there's a particular aspect of equity that she is interested in. And there's also work by Carolyn Finney and others who have just, you know, added to what this looks like. Audrey Peterman has contributed to this conversation when it comes to our national parks. So, you know, the dimension of green spaces and equity could also depend on the book, but those are a few that I can mention.
Thank you. And Vinice did add Black Faces and White Spaces. So that's kind of an essential reading on this topic. Another question from Kathleen: how can we ensure housing and healthy, non-toxic living green spaces are inextricably linked for equity in health and experience? So how can we ensure that who do we need to talk to, or what levers do we have to push to make sure that there is this linkage between you know, equitable housing and affordable housing and healthy housing and healthy green spaces?
I think that's a good question. Actually, Isabelle alluded to it earlier. I mean, there are different scopes of it's a system that has put us into this situation. So I think there are also different angles for that. She alluded to the sense of, you know, even within the planning community, improving the conversations amongst the planning community, but also when it comes to, you know, the decision makers at different levels of government, you know, making sure you're involved or at least aware of different planning decisions and you know, being aware of what is going on and participating in the process, I think is really important, particularly at the local level.
And to build on that, I would say that in the District of Columbia, and I think throughout the DMV, property values have escalated, and there's extensive gentrification. And anytime there is an opportunity, you know, to preserve or expand a green space, people argue, well, is that really the highest and best use? And so they say, well, we really need low-income housing, and low-income housing should trump, you know, the green space. And so I'm always arguing that you're really undervaluing, you know, the green space is as essential as it is for the housing. They have to be together. If you put people in a dense urban environment without access to proper green space opportunities, you're really doing them a disservice.
Well, and what I want to add to what John just said is that, we always sit in front of the county council to kind of, fight for our budget, and then I know that when you think about a public facility, like they always go like, oh, parks is a public facility, but it's beyond that, because can you imagine a type of space that it doesn't matter how old you are, you can still go, Schools are very important because they, generate education to transform people from kids to adults. But if I move to a county and, my kids are out of the school time, the schools will be useful for a certain period of time. Some housing, sometimes it's transient, you rent one place, you rent another, but parks are there. Like, it doesn't matter. It's the most inclusive, the most democratic place you can ever imagine. And I think in a way, people underlook parks because they don't understand the benefit that brings to your own health. And sometimes it's because they couldn't experience yet that. That's why it's so important for people to have that, not just like a physical accessibility, but it's the idea that if you don't have it, you miss it. And I think that a lot of the communities cannot experience that. I missed being in a green space, like I myself, before I came to the US, it was just like, oh, you travel, once, twice a year to this sort of nature place. But because, I lived in a very urbanized area, like with probably the lowest index of trees square footage per person. So it's what you're used to and what you should have the right to. It's not just because you are in a public housing that you shouldn't have access to. It shouldn't be one or the other, like Joe was saying. It should be both. There are ways, instead of having a huge park, can you integrate actually the park with the community? So not only the higher income areas have, your window facing the parks, and then part of our general plan is trying to build communities within, a 10, 15-minute walk or bike, So if we start creating these tools that we can predict, what are the areas where you don't have that infrastructure? Because if you offer that infrastructure of park accessibility, like why don't you do a park-oriented development, when you think about it, because they have the trans-oriented, but usually they try to put a lot of hardscape and don't bring the green. Can we also do sort of a transit park-oriented development? So it's not one or the other, it's you need education and you need food at your table. It's not one or the other, it's like you have to have both. It's just the balance between them. So I think that we should learn how to work together as a community and not do one cause versus the other, but understand that if you have a balance of access to a lot of these wonderful things you can do, including green space at the same table, we would be more human, I think. We'll be able to work better as a society.
Absolutely.
May I add something?
Oh, sure.
No. Something that also comes to mind has to do with COVID, because we are still, let's say, talking a lot about how the inner city parks are being improved or new parks are being built as much as redeveloped areas are also going up. But with COVID, we are starting to see a return of people of a certain higher class to not the suburbs, but the further rural areas. And so I think one of the main questions we need to think about, and as planners, as researchers, is that what happens both to parks in neighborhoods that are still underserved, underfunded, plus those of gentrified areas that might never actually see new residents moving in, because those have now the funds to not move closer to the center, but actually much further away and to telecommute, because that's the type of jobs they hold. And so I think that there's a double risk of both parks in underfunded areas to be even more underfunded, and then those in the kind of previously or within processes of gentrification areas to be much more surveilled, to be much more controlled, and at the same time to not have that many residents. So I don't, like, really, I think COVID might redistribute a little bit the cards of equity and funding and who has access to what. It could also be an opportunity because actually you have areas that were being both greened and redeveloped. You know, there might be actually space for different income groups to move in and to remain. But then again, what neighborhood will those be if at the same time they have lost so much of other types of businesses that were already displaced by gentrification, or people just don't use public spaces the same way now post-COVID as, let's say, a year ago, even 9 months ago.
Absolutely. And Kathleen did, we're coming into overtime here, but Kathleen did clarify her question a little bit. One thing that I messed up when I kind of rephrased her question was the healthy and non-toxic living piece, which is speaking to, you know, not putting polluting industry anywhere near, you know, just taking that out of the equation, you know, 100%, and moving towards more sustainable ways of living and such. But we don't have a whole lot of time to dig into it now, so I'm sorry, Kathleen. Panelists, thank you very, very much. Cristina, John, Vinice, Brenda, Isabelle. Any resources that you'd like to share with the group, you can send it my way, and I can add it to the attendee packet. And speaking of the attendee packet, I'm going to put the link right back here in the chat for everyone to figure out which session they would like to go to next. Your options are Baltimore Code Red, one second. So Baltimore Code Red, Baltimore's fight for climate justice, and also EJ Legal Tools, where two legendary EJ litigators and one legendary community member will discuss the different tools for taking the fight to court. All right, and Vinice just posted a link to a legislative EJ hearing that happened this week. So thank you all again. We can't do the round of, well, I guess we could. Anyone who wants to can turn off their mics and we can do a round of applause. Thank you all, and I will leave this room open until 1:10, and then I will hop out. So make sure you have that link to get to the other sessions.
Thank you, everybody.
Okay, Michael.
Thank you.
Thanks,
Have a
everyone.
great weekend. Bye.
Thank you.
Sorry, I only sent the links to Cindy, I think, because she had sent me a question directly. So there are the links in the chat to everyone.